turn on the recording and take it away, Jill. And if you want to share your screen.
Okay, yeah, great. Thank you, Kathleen, for allowing me to be a presenter. I'm excited to share some of my knowledge with people just to help make their journey in the healthcare system hopefully easier. So I will share my screen. All right, are you guys all good?
Yeah, it does show your
it does. It shows my notes.
Right.
Well, let me see if I can figure out another way.
Let's see. And now it went away.
It did. Okay.
Yeah. So it worked when we were rehearsing.
let me try it. Let me try.
There you go. That's it. That's
Perfect.
great. Yeah.
Wait, but the problem is I don't have my presenter view on my end. Let me just see.
See if that works? Yeah, we're good. Perfect.
You're good. Okay.
All right. Nice going.
I'm going to, there we go. Okay. All right. Well, like Kathleen said, I am in the founder of Simpler Health Advocates. Simpler Health Advocates is a professional service that helps guide people through the healthcare system. We act as a bridge, closing the gap between the system and the patient, family, or caregiver. And we provide support needed so our clients can make individual and well-informed medical decisions. And we can also help identify challenges our clients are facing in their healthcare journey and brainstorm solutions. But perhaps most importantly, we can be a constant source of support during a time when it's needed most. So I've already advanced my slide here. I'm also an educator for Care Partner Project, which is a nonprofit organization that focuses on patient safety for the most part in the healthcare or in the hospital. They have checklists available for people that are pre-surgery or people that have family members in the hospital and they want a safety checklist. You can go to the Care Partner Project website and get those checklists if you're interested in that. So unfortunately, there are issues with our healthcare system, and it is complicated, expensive, and often inefficient, creating barriers for safe and effective healthcare, which everyone deserves. With such a complex system, many people feel as though they are getting lost or just a number in the system. Medical errors now are considered the third leading cause of death in the United States. There was a call to action about 20 years ago to reduce medical errors by 90% by the year 2012. However, a recent report indicates that our healthcare system has not progressed in meeting patient safety goals, and that the medical community seems to have lost its commitment to safety, partly because they're overwhelmed. They have lots of other things that are pulling their attention. And many organizations that were previously champions for safety have moved to other issues. Dedication to the reduction of the medical errors is now diluted by COVID, workforce safety, racial injustice, and value. In the last 2 decades, the country has not achieved the level of safety and daily patient care that we expect from other industries, such as the airline industry. The decline in safety is frightening. As patients and families, we know safety is fundamental, not something that can ever fall off the list of priorities. Because of the complexity and the fact that our healthcare system is stressed, it is more important than ever before that we take an active role in our healthcare. Patient engagement used to be a fairly passive role. Physicians were in a position of authority, with patients playing, like I said, a passive role in care. Physicians instructed patients about what to do, and patients rarely took part in the treatment decision. Patients' mindset was that the system would take care of them. However, this model is no longer effective for safe and effective healthcare. There's been a larger awakening in the medical system to focus on patient-centered care, recognizing the knowledge patients have and the contributions patients can make to manage and add to decision-making about their healthcare. So with patient-centered care, patient and physicians both contribute to the medical decision-making process. Providers explain treatment and alternatives to patient and help them choose the treatment option that best aligns with their desires and beliefs. And patient-centered care empowers patients to become active participants in their care. A growing body of evidence shows that people with higher patient involvement in healthcare decisions, such as having the knowledge, skills, and competence to become actively engaged in their healthcare, improve the safety and quality of their healthcare, and have better health outcomes. One of the best ways to improve one's health is to take an active role in it. The Take Charge campaign is a public awareness campaign that has significant potential to improve patient safety and engagement. This campaign encourages people to become informed and active participants in their healthcare team by taking 5 steps to safer healthcare. Today, I'm going to talk to you about the things that you can do for safer and more effective healthcare. So the 5 steps include understand and complete your advanced directives, keep a record of your medical history and current medications, prepare for doctor visits, make a list of questions, prevent infections, ask caregivers to wash their hands, use an advocate or be an advocate for others. Learning how to be informed patients before a crisis strikes can lead to better healthcare outcomes. So the first step is to understand and complete your advanced directives. You have the right to make decisions about the healthcare you get now and in the future. Advanced directives is a general name for several kinds of legal documents you can sign to help ensure that your wishes about medical treatment are known and respected if you are unable to communicate for yourself. First is a living will, which is a legal document that outlines your preferences for medical care if you become incapacitated. Remember, this doesn't become effective until you're unable to make your own decisions. This would play into parts such as if you're on a ventilator, maybe you've had a stroke and you're unable to communicate, or dementia. Healthcare power of attorney is the person you designate to make medical decisions if you can't. So this person communicates the wishes you've outlined in your living will. So make sure you designate someone who can speak on your behalf at times you can't. It's important to review your living will with your healthcare power of attorney and update periodically, especially if you have a change in your healthcare. Make sure that you pick somebody. Your healthcare power of attorney can be a family member, it can be a friend, or it can be a professional like myself. But just make sure you choose somebody that their own beliefs or desires won't get in the way of what you have shared with them about your desires. The do not resuscitate is an order by a doctor that lets medical personnel know that you do not want life-sustaining treatment if you become unresponsive. This often comes into play for someone with a terminal illness or an older individual. The DNR orders are used typically when there is a lower chance of survival with CPR if a person's heart stops beating. Then another document is a physician's order for life-sustaining treatment, also called a POLST. This is used for seriously ill and frail individuals. It gives more specific direction for these individual healthcare options. So it can include more specific information than the living will or a DNR order. Open, honest conversations about end-of-life medical decisions will alleviate the burden placed on loved ones and healthcare providers of not knowing your wishes when facing a healthcare or medical crisis. I've included a couple websites that I feel like have really good information about how to communicate your wishes, documents you can use. There's Caring Info, and then there's also 5 Wishes. So these will give you some great direction on how to start conversations with people, how to just specific directions on what your wishes might look like. So I think these are great documents to use in these conversations. So the next one is to keep a record of your medical history and current medications. Just as a resume helps an employer understand your suitability for a job, A personal medical history helps a clinician understand the whole picture of you as a patient. That's especially true when you're seeing a healthcare provider for the first time or when you see multiple providers. Not only does this history help the healthcare provider, it also gives a truer picture of your own long-term health. When you're starting to choose how to keep your medical records, choose your medium, whether it be paper, computer, make sure you back it up on the computer if you use that, or a mobile device. Every time something happens related to your health, add it to your records, whether that's an illness, an accident, you've added a new medication, blood work, x-rays, or hospital stay. It's important to keep track of surgeries and medication, and also include procedures like mammograms and colonoscopies. Make sure you add dates and as much detail as you can to your medical records, such as what happened, why did it happen, who cared for you and where, and what was the outcome. But only keep the essentials. You don't need to keep years of lab work, just to keep your records as concise as possible. When keeping a list of your medications, some doctors suggest you put all of your prescription drugs, over-the-counter medicines, vitamins, herbal remedies, and supplements in a bag and bring them to your appointments. Others recommend you bring a list of everything you take. This is to include the name of the medicine, dosage and frequency copied right from the label. And the reason this is really important is because your pharmacist doesn't explain it to you. And the doctor has ordered 5 milligrams. It may come in 2.5 milligram tablets. So then you need to take 2 tablets. So I always encourage everybody to make sure you copy the information straight from the label. Also include vitamins and other non-prescription medications, over-the-counter products for indigestion, pain, eye drops that you use regularly. This is just an example of how somebody kept track of their medication. So they just put it on a spreadsheet, included the brand name, the generic name, the purpose for it, possible side effects, the prescriber, and any other comments you might want to include in your document. This is just to give you a visual. Obtaining and amending your medical records. You have the right to see and get a copy of your medical record and to amend your medical record, meaning you have the right to have information added to your medical record or to make it more complete or accurate. So if you get on your portal and you see that there's something not accurate, you have the right to send this information to your provider and have the information updated or changed, amended. Obtaining your personal health records is as simple as making medical records requests from your doctor or hospital. But now with the portal, you also have access to your medical record through the electronic medical record. So hopefully, if you don't have access, you can request access through your provider. Also through hospitals, you can obtain your medical record through hospitals. Access to your personal medical record is guaranteed under the Health Insurance Portability and Accountability Act. Under this law, patients can submit a records request, and the personal records must be provided within 30 days. Hopefully, it won't be 30 days, but providers do have 30 days to provide you with a copy of your record, a paper copy anyway. The reality is that healthcare consists of an assortment of primary care physicians and specialists, supplemented by visits to urgent care clinics and emergency rooms. Now, it's not unusual for someone to see their primary care, a cardiologist, a rheumatologist, gastroenterologist, or an orthopedic specialist. Unfortunately, this patchwork of healthcare often comes with a disorganized collection of medical records to the point where it's unlikely that any one doctor knows a patient's entire health history. For safe and effective healthcare, patients need to be able to share their medical history with providers. So preparing for doctor visits. Doctors have mounting demands on their time. It's just the reality now. The amount of time they have for patients is now dictated by many factors. So before you have an appointment, do some preparation so you can make the most out of your appointment. They make a list and prioritize your concerns. Do you have new symptoms? Are you concerned about how treatment is affecting your daily life? Do you want a flu shot? If you have more than a few items to discuss, put them in order and ask the most important ones first. Don't put off the things that are important until the end of your appointment. Bring them up right away. Take information with you, like the medical records you've completed, so you can update your doctor. And this is a visual from NIH, and it says talking with your doctor, tips for seniors. You only have 18 seconds. That's the average time a doctor waits before interrupting a patient. So you don't have your thoughts together before you go. The chances are you may get interrupted and not be able to ask the questions that you want to ask. So as a patient, it's important you're able to obtain, communicate, process, and understand basic health information. So I always say prepare before you go. So when you get there, typically people are flustered, get sidetracked with something. And so if you have everything written down, prioritized, you can get more out of your doctor appointment. The National Institutes of Health developed an educational program that encourages patients and families to ask 3 specific questions of their providers to better understand their health conditions and what they need to do to stay healthy. I encourage clients to ask these questions at every doctor's appointment. The questions are, what is my main problem? What do I need to do? And why is it important for me to do this? Often, if we understand the why behind something, we are more likely to be compliant. Ask Me 3 is intended to help clients or patients become more active members of their healthcare team and provide a critical platform to improve communications between patients, families, and healthcare professionals. Diagnostic errors are the most common, catastrophic, and costly of all medical errors, resulting in thousands of patients suffering serious harm every year. It's estimated that 12 million Americans a year are misdiagnosed with a condition they don't have. In approximately half of these cases, the misdiagnosis can have serious consequences on a person's health. It can delay recovery and sometimes call for treatment that is harmful. So anytime you're struggling with a diagnosis or you're not improving with a current treatment plan, don't be afraid to ask these questions. And the questions are, what do you think it is? Typically they'll have an opinion, but what else could it be? And could it be more than one thing? Sometimes your diagnosis is the most likely thing that's wrong, but it may not be the right thing. So encourage your doctor or nurse to think about other possible reasons for your illness. Getting a second opinion. Sometimes your health problems are straightforward, but there are other times when diagnosis and treatment are less clear. A second opinion means that you choose to see another doctor or specialist after you've received an initial diagnosis or treatment plan for a medical condition. The second doctor reviews your medical history and will give you their view on your diagnosis or treatment plan. Getting a second opinion can help you make better health decisions. If the second doctor agrees with the first, you may decide to return to your first doctor and move forward with your treatment. You can also ask your doctors to work together as a team. If their opinions are different, you can use the new information to help you make the best choices for you. When should you get a second opinion? This is a list of times that you might consider getting a second opinion. When your diagnosis isn't clear, you have a lot of medical conditions, your treatment offered is experimental, controversial, or risky. You have a rare condition, you have a life-threatening condition, you have many treatments to choose from, you're not responding to treatment, you feel like you can't talk to your current doctor, your doctor doesn't specialize in your current condition, and you just want peace of mind of having another person's opinion. When getting a second opinion, it is important to seek out a doctor from another practice, and ideally one in a different area. So don't use a doctor within the same practice. When surveyed, 99% of doctors say they don't feel comfortable second guessing a colleague's opinion. So this is something that, like I said, they might be within the same practice. So I encourage people for a second opinion to go completely outside of the practice of the first opinion they received. In all cases, if you're seeing a specialist, ask to see a doctor with at least the same level of training and expertise. And consider only board certified doctors. The next step is preventing infections. ask caregivers to wash their hands. Hand washing is the #1 way to prevent an infection such as MRSA, C. diff, and other common bacteria and viruses that circulate in healthcare settings. 1 in 25 people who are hospitalized will get an infection. 50% of medical providers fail to perform hand hygiene. So don't be shy. If you don't see your healthcare providers clean their hands, ask them to. Gentle but assertive reminders can be life-saving. And you can say things such as, I'm really afraid of infections. Would you mind washing your hands before we start? Or before you start the exam, would you mind cleaning your hands again? When you speak up for yourself, you're really speaking up for everyone. And remember, it's your health or the health of your loved ones. And this is really intimidating to speak up to a provider, but it's your right to make sure that they've washed their hands and just for your own health protection. Indications for hand washing. So healthcare personnel should use an alcohol-based hand cleanser or wash with soap and water for the following critical indications. So immediately before touching a patient, before performing an antiseptic task, such as placing an indwelling device or handling invasive medical devices, before moving from work on one soiled body site to a clean body site on the same patient. So maybe you have an open wound, they look at it and then they do something else. They should wash their hands anytime they move from a soiled site to a clean site. After touching a patient or the patient's immediate environment, and after contact with bloody body fluids or contaminated surfaces, and immediately after glove removal, which this is a big mistake of a lot of providers, is they don't wash their hands after they remove their gloves, but they should always do that. Preventing infections is everyone's job, and simple hand washing with soap and water and alcohol-based cleanser goes a long way toward protecting every patient. So the next step is using an advocate or to be an advocate. So bring someone with you. Everyone getting medical treatment should have someone to support them, to help raise questions, take notes, enhance communication with medical staff, and make sure they are receiving patient-centered care. 40 to 80% of medical information provided by healthcare practitioners is forgotten immediately. So the greater the amount of information presented, the lower the proportion correctly recalled. Furthermore, almost half the information provided at appointments is not remembered correctly. An advocate, whether family or friend or professional, can provide support to guard against any of the many mishaps that make medical errors one of the leading causes of preventable death in this country. The sicker, less on top of things the patient is, the more that an advocate is needed. And they help the patient to be more involved in their healthcare, leading to better outcomes. So patient advocates may play different roles in different situations, but in the most basic sense, an advocate is a helper. Sometimes patients need someone other than family and friends to guide them through their healthcare journey. So hiring a private patient advocate with insider knowledge and direct experience with how the healthcare system works is sometimes necessary to help navigate the healthcare system. Advocates make sure clients' voices and choices are heard, and that clients have the relevant information and appropriate understanding of their situation. So some services that might be provided by a private advocate include accompaniment to doctor's appointments, where they can take notes during the appointments, review the notes with you later, medication reviews and coordination to encourage compliance and minimize conflicts. They can develop medication calendars, facilitate communication among patients, caregivers, and doctors, interpret difficult medical information and terminology to make it more patient-friendly. The coordination of appointments, so with lab, radiology, different doctors. The development of a list of questions for patients to ask their providers. Sometimes patient advocates have more information and just know the right questions to ask. They can develop medical timelines. They can also help with the coordination with other professionals who help patients, such as social workers, nursing home, or assisted living administrators. Financial, emotional, physical impact of navigating healthcare for patients and their caregivers is also often overwhelming and life-changing. Having help with the most confusing and frustrating parts of dealing with healthcare will reduce stress levels and provide peace of mind that someone is looking out for your best interest. So safety during transitions. A transition of care is the movement of patients from one healthcare provider or setting to another as their condition and care needs change. Transitions of care is a complex process representing a time of significant vulnerability for patients. The levels of care may include hospitals, ambulatory primary care practices, ambulatory specialty care practices, long-term care facilities, home health care, and rehabilitation facilities. Transitions also include shift change and when a patient is moving from one provider to another. So when somebody's in the hospital, a new nurse comes on, or hospitalists change shifts every 12 hours. This is also considered a transition of care. Transitions increase the risk of adverse events due to the potential for miscommunication as responsibility is given to new parties. Poorly executed care transitions may lead to less than desirable clinical outcomes, such as wrong treatment, delay in diagnosis, and severe adverse events. This is a very important time to have an advocate to double check everything and to be a second set of ears. Hospital stays. Just because you're wearing a hospital gown and are in a hospital bed and doctors have been seeing you does not mean you are considered an admitted patient. So what makes the difference? So there are two types of hospitals: patient status. There's observation and inpatient. So hospital admission status affects Medicare coverage of skilled nursing services that may be needed after discharge from the hospital. And can be costly for patients if Medicare doesn't cover skilled services such as physical therapy, occupational therapy, and skilled nursing services. So you ask, why wouldn't Medicare cover if the doctor said you needed the care? Reality is Medicare requires a 3-day minimum hospital inpatient stay, which those are counted by overnights before it will cover the cost of rehab care you may need in a skilled nursing care center or outpatient physical therapy, outpatient occupational therapy. So observation status, regardless of the length, does not count toward Medicare requirements. So even if you're not sure if you'll need rehab or longer care at a nursing facility, it's always worth fighting for admission status, or at least finding out what your status is if you're in the hospital, whether you're as an observation status or an inpatient status. I hope this has provided you with information so you can get the most out of your healthcare and that you have a positive experiences as patients in our healthcare system. So,
Great, thank you.
You're welcome. Well, I'm happy to answer any questions that people might have.
Yeah, I have a few.
Okay.
There's a comment that, did I hear correctly that medical errors are the third leading cause of death? Is that,
Yes, that is,
okay.
That is accurate. There are some studies that suggest that. The reality is medical errors aren't typically the cause of death, but they can attribute people's death because of medical errors. Does that make sense?
Yeah.
Yeah. So, yeah.
No, I think that was a surprising statistic.
Yeah,
And
it's medical errors are a huge issue in our healthcare system. The system is complex. Software systems don't communicate. People are short-staffed. They're overwhelmed. Providers are pulled in lots of different directions because of insurance requirements. So it just has become a reality.
Yeah,
which is unfortunate.
And we sort of, you and I talked about this a little bit before the program, but at least I've been hearing really recently a lot of advertisements, mostly by like medical practices or hospitals, that they have nurse navigators. So what's the difference between a nurse navigator and a healthcare advocate?
Basically, a nurse navigator, if they're employed by either a hospital or insurance company, they're going to cover the hospital stay. That's their focus, is why the patient is in the hospital. So they wouldn't typically cover them after the hospital stay. And the same with the insurance. Their priority is to meet insurance needs more so than just the needs of the patient. They're making sure they follow which these are certainly valuable for the patients. Don't get me wrong about that, but they're making sure that the patient is following the doctor's orders. They have the medications they need, that kind of thing. Where a private advocate will follow the patient through the continuum. So they'll work with them before their admission to a hospital. They may not even need to be admitted to the hospital. They'll work with pharmacy. They'll work with social workers. They'll communicate with family members, where that's probably not something a nurse navigator in the hospital or employed by a insurance company. Those are those kinds of things they won't do. They probably will not take on.
I encourage any of you, if you have a question, do put it in the chat or raise your hand. And I've got a couple more, but I'd love to hear from all of you or some of you if you're curious about anything. I guess how are health advocates? Is that sort of service covered by insurance or Medicare, or is it just a separate?
It's a private pay service, and I'd say it's not much unlike hiring an accountant to help with taxes or hiring a lawyer to help with your legal needs. You're hiring a professional who knows the systems, knows the ins and outs of healthcare, and can just make the journey less stressful, and somebody that can ask the right questions or can push a little bit harder than a lot of people are typically comfortable pushing, just because we typically either are nurses or doctors that have chosen to do this, or somebody that has had their own personal experience are also private advocates. So there's lots of professional organizations that are supporting patient advocacy. So like I said, it's a growing profession. And just as the complexity of our healthcare system has become, the need has just gotten greater for people to have someone other than family and friends that can just provide a little more information.
Yeah. I mean, it sounds like the services are pretty extensive, because does it go beyond the health part of it, but also, I mean, as an advocate, do you help people like sort out insurance issues and that sort of thing?
You can't. I just do medical navigation because that's what I know. But people, insurance navigators, so people that know the insurance side of healthcare. That's sort of kind of the two main ones, I would say: medical navigation and insurance navigation, because people can lose thousands of dollars if there's an error on their bill and they don't know it, or they've been overcharged, they don't know how to read the bills. So there are people that just do insurance.
So that's like a separate
billing, basically billing.
So we have a question that asks, like, how much can a person expect to pay for these sorts of services?
It varies depending on what the needs are of the patient. I'm going to say the range is, I know, from basically $100 to $500, depending on the location of the advocate, their experience. Typically, this is certainly more popular on the coast. It's becoming more common in the Midwest. I'm still just educating people on the value. So I'm I'm also a board certified patient advocate. So I have a certification. So I have to meet a certain standard to be able to call myself a board certified patient advocate. So I've tested, I've got experience, I've got references, and there's a couple professional organizations that I cannot be listed on those organizations unless I am board certified. So that gives people sort of a, what's the word I'm looking for, an idea of standards. So I've agreed to certain ethics. I've agreed to only staying within my scope, not taking on things that are outside my scope. So I kind of got off the main subject, but there is a range of fees that are charged for the service. So through the Care Partner Project, I have available to help with people that don't have the resource to pay for my services. typically about 5 hours is what they'll cover. So I can apply for that for people that are don't have the resources.
Yeah, actually, that was my next question is
Yeah,
talking a little bit more about that Care Partner project and
yeah,
what the mission of
yeah.
that organization
Yeah.
is.
So it's a nonprofit organization. It's a lady that started that had a tragic outcome with her father with a hospital stay. And so she's just made it her mission to help people make sure they get safe healthcare while they're in the hospital and just to give them some direction. So checklists. So to make sure that, pre-surgery that they've gone through a surgery checklist, things to look for when you're in the room with patients or your family member, things to ask about when they're administering medications, the 5 questions, is the right patient, the right route, the right dose. So there's some great checklist on that website. And like I said, it's a nonprofit organization and they do offer some assistance for people for advocacy that don't have the resources.
Great. So what's the reaction of like the medical, like the doctors and the nurses in terms of working with a healthcare
Yeah.
advocate? Are you welcomed? Are
Yeah,
do
yeah.
they like it? Do they not?
Yeah. I think once doctors have worked with me, they're like, oh yeah, this really adds to the team.
Mhm.
What I always say is I never come between my clients and their providers. I don't make any decisions for my clients. I just help them get the information they need to make their own decisions and make sure they can make well-informed decisions. So once providers see that I'm part of the team and not there to look over I'm certainly not there to look over their shoulder. I'm not there to question the information. I'm there just to make sure that my clients have enough information and that they understand the information they've been given. So,
Okay. Yeah, that makes sense. One thing that kind of struck me because you showed that spreadsheet with all the different medications and are there any like systems out there like or apps or
there are some great apps on your phone, and depending on what kind of phone you have, you can Google, med administration, med tracking. So there are several really good apps out there to use, which I think is a great idea for people because then when you go to your provider, you have all the information right there. And then you don't have to, take a list with you every time, as long as you keep it up to date, just like your medical records, of course, updating them. Medication errors is another huge error that people experience. The communication, they're just, information gets dropped, doses don't get changed from one provider to the other. Our systems don't communicate. So KU's health system doesn't communicate with LMH's health system. So information has to be sent in different directions that way, but they don't interface, which makes it challenging to keep things up to date, especially if you have multiple providers.
Right. Question from Kay, do you think that patient portals are helpful?
I think they are very helpful. You can share it with your family members if you want. You can look at it and make sure the information is accurate. That sometimes providers will be making notes and they'll say, going to do a CT scan in 3 months follow up. But then it may drop off their radar. So you can make those own notes on your own, say, you know what, we're going to follow up in 3 months about my CT scan. Just so you can take information out of the information that the provider has documented and just do your own due diligence to make sure things are followed through with. So I think it's a great reference to look at and to go back to is like, what did he say? I don't really remember what, the information was that was given to me. You can go back and reference the doctor's appointments. So I think there is a lot of value in the electronic medical record. Unfortunately, a lot of people don't know how to access or don't understand the record because there is a lot of information in there that I don't want to say is extra, but just can kind of bog down kind of the nuts and bolts.
Yeah. Yeah, I think the learning curve on those is, just things like test results.
Yeah.
You kind of expect, at least if you're old school like me, you kind of expect a phone call and then all of a sudden it's like, oh no, it's in your portal.
Yeah, I know.
And
Which I still think there should be communication. But like I said, I think things fall through the cracks. I don't think anybody intends not to communicate. It
Right.
just, that it just happens. And so there's not any one person by any means to blame for some of the communication issues that happen.
Yeah. Yeah. No, absolutely. You're just you're just dealing with human beings, right?
Yes.
So that happens.
Yes. Absolutely.
Yeah, your comments about advanced directives were really interesting. We've done lots of classes at the
Have you?
library on those topics,
Mhm.
usually because I guess tax day, April 15th is Advanced
Yeah.
Directive Day
Yeah.
officially. So
Yes.
remember
Yeah.
that when you file your taxes to also make sure you have an advanced directive.
Mhm.
But a couple things like the hospital has partnered with us on those, and they recommend that you make sure that the hospital has a copy of your advanced directives, which never would have occurred to me to file it with LMH.
Yep.
But I thought that was a good tip.
Yeah. Because if you go, I mean, say you go in for surgery and something, something happens during the procedure or whatever, they have the information there. It's accurate. They don't have to send a family member home to try to find it or, that kind of thing. So it is a good practice. Also, just
Right.
give it to your provider so they have the same information.
Well, in the other tip, and I'd love to kind of hear about your experiences with this, making sure that you talk to your family as well and make your wishes known to them, because there are situations where maybe you have multiple kids and they disagree and you're not able to advocate for yourself, but yet in your advanced directives you have these you know wishes outlined, but maybe the physician is hesitant to go there if not all the family is supportive of what you're advocating. I don't, have you run into that?
Yeah, well, that's where it's really important to designate a person to make those decisions. And if you have 3 children, that I understand that gets complicated and touchy, then that's maybe when you choose an outside person to be your healthcare power of attorney, so they can make those decisions, the ones that you've shared with them. And yeah, when there's conflicting opinion and there's not a healthcare power of attorney designated, then they do go to family, and it gets very challenging, and lots of feelings involved and emotions involved.
Right. No, I mean, it's a difficult time for everybody.
Yes.
And
Yes. Yeah. So
always,
that's all been well communicated beforehand. The healthcare power of attorney can competently, say, I know this is what their desires and wishes are. We've talked about it. I've got the document here. And so it just alleviates those gray areas.
right. Right. Now, I think it's really important. And again, I think that was another kind of tip that when it was actually an attorney who worked for a hospital who made it very, very clear that talking to your family is almost equally as important.
Yeah, and they are difficult conversations. And 5 Wishes is a great website to get some forms to just help steer those conversations.
Okay, and that's the 5wishes.org. Is that right?
Yes.
Okay, great. Yeah, does anybody else have any other questions or comments? Or feel free to unmute if you do, because we've got probably about 10 minutes left in our hour. Yes, Jack. There you go.
One of the other things I wanted to point out that we learned about the portals that make it really important is I think most all of our doctors are LMH doctors, and we're lucky that we happen to live in a city where the hospital has a lot of affiliated doctors. It's not true everywhere, but because it's true here, if you give one of them your living will or anything else, they all have that. So if your personal provider, your internist or whatever has your living will, the hospital also has it.
That's it.
And that's a really kind of nice thing to know. It's done for 80 or 90% of your medical health.
Yeah, thank you for sharing that. That's a good point.
And you had mentioned that like KU and LMH, their systems don't talk to each other. So in that case, you'd need to make sure that
Yeah,
both have
KU
those.
would have to have that, yeah. KU's Epic and LMH is Cerner, so it's just.
Okay. That makes sense.
But you can ask to have those records transferred.
You can,
Yes.
and hopefully they will get transferred there. I just worked with a client that could not, we ended up printing them because they don't get sent directly to the provider. They get sent through a physician referral system, and it gets complicated. And we were sort of in a time crunch, so we ended up printing them, which, you know, is crazy nowadays, but it happens. So.
Yeah, I have another experience with that too, because I also go to the VA and the systems are not at this time compatible. And both my doctor and the VA tried to work it out. And the end result is I physically carry my VA records to my doctor and they scan it in. The only problem is test results don't show on the portal. A doctor has to go in to look at addendums to find it. So if I went to the emergency room, I don't know if that staff is going to dig deeper than the face of the portal, and they may not have my latest records.
Yeah, yeah.
It's the only way to get it there is to take it.
Yeah, yeah, and be assured that it's there. Because LMH told me they sent him. I called the nurse, she couldn't find him. We went kind of roundabout. You know, we probably spent 2 hours trying to figure out where her records ended up, and we needed him to be there. So they just printed them and she hand carried them. So, which, you know, it's unfortunate, but they got there. So
Yeah. Yeah. Now the whole technology piece is awesome on one level and complicating on another.
Yes.
So
it's awesome when it works for you.
Yeah.
So.
Exactly. Yeah. Anyone else have a question or a comment? Yeah, Nancy.
Yeah, a quick question on accessibility to someone like you. Do most people, are they, you know, they're anticipating something coming up? I'm thinking about the person that gets admitted, doesn't know life is going to get really complicated, and how quickly can you all be on board for someone like that?
Fair. I mean,
do you have plenty of people that do what you do that can be?
Actually, I'm the only one that's doing this in my business.
All right.
So just depending on my availability, but if I'm available, I'm certainly happy to go to the hospital on an emergency kind of basis. My clients that I have are, I'm not dealing with hospital admissions currently. So we're dealing with a complex diagnosis, can't get a diagnosis. So making, getting referrals for other opinions and that kind of thing. I have a client who's got probably 8 different providers, and he just on 3 different systems. So there's Stormont, KU, LMH. So just keeping track of that alone can be really overwhelming. So I just keep track of that for him and go to doctor's appointments, communicate with his partner. She's not able to attend with him, just keep her up to date on what's going on. Got a client with dementia who I coordinate her home health care. Her 2 healthcare power of attorneys. She doesn't have any children or family, so they hired me to oversee her home health care. So I'm trying to keep her in her home as long as possible. So I don't want to say did the hiring, but basically found the home health companions to support her in her home. So those are some examples of people I've worked with or are working with. But certainly I'm happy to go if somebody's having a surgery, preparing for that, no any questions, stay for that procedure, or if somebody's an inpatient, just go in and make sure the information's accurate, or the transition from hospital to home or nursing home or rehab, just to make sure that all the information's accurate. So did that answer your question?
Somewhat, yeah. I was looking for availability, like how quickly you can be there for someone.
Yeah, I mean, I can't guarantee it, but I certainly would try to be available.
Yeah, thank you.
I have a question.
Sure.
This is Barbara. What would you go over again about the 2 different types of hospital stays and how it impacts Medicare?
So there's inpatient and there's observation. So some people will be admitted the first day and it might be observation before they meet the criteria to be inpatient. Sometimes people, I mean, obviously there are very certain criteria that you have to meet to be considered inpatient, but it's, if you're in observations, it's always worth a conversation. It's like, hey, what would need to happen for me to be inpatient? So inpatient is Medicare requires 3 overnights before you qualify for rehab, physical therapy, occupational therapy, whether that's inpatient rehab or whether you go home and you just need a little assistance when you go home for a short time, up to 100 days is what Medicare will cover. So if you qualify for after those 3 overnights, you can have physical therapy, occupational therapy, a skilled nursing. And with that skilled nursing, you can also have an aide come a couple times a week. So did that answer your question? And it's not, you know, it's not a physician's like, oh, I'm just going to leave them observation. There's no advantage for the physician to be one or the other. It's a matter of qualifying. But sometimes with a little push, they may be able to say like, oh yeah, we do, you know, whatever, we can do this and that'll make you qualify for inpatient.
Yeah, thank you very much.
That's great. So do
I
you
have
help?
a question. Oh,
Sure. No, go
this
for it.
is Joan. So what can the doctor's office or hospitals charge you a fee to obtain your records?
Oh, they can, yes. But I don't think, I've never seen them do that. I think typically when they charge is if an insurance company is requesting them or maybe it's a legal issue, that kind of thing. There may be a charge. You know, if somebody's requesting them every few weeks, there might be a charge. I've never seen a charge passed along.
No, because if this law, we have to give them.
It just seems like when I transferred physicians that I lost all my records because they only transferred 3 years.
Well, I think they're required to keep, I think it's 10 years. So they have to have them somewhere and they may be paper and they don't, you know, for them to go get them would be somewhat of a challenge. So they probably just sent what they have electronically, I'm guessing, but of course, I don't know that for sure.
Okay.
But they have them somewhere. They have to keep those.
And
Okay.
we have a clarification question from Carol to clarify, please, even if I stay overnight in the hospital, it could still be observation.
Yes,
Okay.
can.
Okay. All right. Anybody else? I think we're bumping up a little bit on 5 o'clock. So as Allison reported, this is our last gray anatomy session for this for the summer. We're going to take July and August off. But we will be in touch with all of you with the list of the new classes so that you can sign up. And I know we have some kind of interesting topics in the hopper. So stay tuned and look for the emails, and everybody stay safe out there. Try not to get COVID like yours truly. But anyway, thank you, Jill, so much. That was really, really informative and helpful. And, you know, I think you did a nice job of, you know, just bringing home the importance of being an advocate for your health, because really that's what you got. It's all you have is yourself and your family and maybe some outside assistance as well.
Yeah,
So
exactly. Yeah. So, yeah. Thank you.
So,
Appreciate it.
great. All right.
All
Thanks so
right.
much. Have a
Thank you.
wonderful evening, everyone.
You as well.
Yeah. Take care.